Good evening, ladies and gentlemen. On behalf of Mindray, I, Kshama Nandode, Senior Marketing Manager, IVD, extends a warm welcome to all of you to our highly anticipated webinar on implementation of new standards in Medical Laboratories ISO15189 2022. It is my absolute pleasure to stand before you today as we delve into the world of quality management systems in medical laboratories. ISO 15189 2022 is the latest edition of the internationally recognized standard that sets out the requirements for competence and quality in medical laboratories. With the ever-increasing importance of accurate and reliable diagnostic services, adherence to this standard has become crucial for laboratories worldwide. Today, we have gathered here to explore the key aspects of ISO 15189 2022 and its impact on medical laboratory community. We are fortunate to have Dr. Jayesh Warade, who will share his insights, experiences, and best practices related to implementing this standard. He will guide us through the intricacies of the new edition, highlight its significant changes, and shed light on the benefits it brings to the field of medical diagnostics. Without further ado, let us commence this enlightening journey into implementation of new standard in medical laboratories ISO 15189 2022. I wish you all an engaging and fruitful experience throughout this webinar. Thank you. Prior to that, let me introduce our eminent speaker, Dr. Jayesh Warade. He is a consultant biochemistry and molecular biology quality manager in Meenakshi Labs, Madurai, Tamil Nadu, India. Dr. Jayesh Warade is an enable accessor for hospitals and laboratories. He is also an expert in process improvement. He is a Lean and Six Sigma consultant. He has a book on risk management in clinical laboratory on his name. He is also an author for over 30 publications, both national and international, on his name. He is a speaker at national and international conferences and is also a member of various national associations and societies. So I invite Dr. Jayesh Warade to enlighten us. Thank you.
Thank you. So can I share the screen now?
Yeah. Yes, sir. Yes, sir. You can.
So good afternoon, everybody. And I can see the number of participants, and by seeing at the number of participants, you can understand what is the importance of this topic, which is the implementation of ISO 15189 2022 standard in a medical laboratory. So this standard, as all of us have come to know, that it has been published in December 2022, and we have a 3 years period to transit or to have a transition of our laboratories for this new standard. So this new standard supersedes the previous standard, which was ISO 15189 2012, and with the implementation or with the launch of this new standard, the old standard has been withdrawn, and we have a period of 3 years to implement this new standard. So basically, why we need a webinar on implementation of this ISO 15189 2022 standard. So many of us might have undergone the 4 days program of training on internal auditing and quality management system with respect to this new standard, where you might have seen the complete interpretation of this standard. You might have done some exercises, some group activities, and you must have undergone the complete interpretation and understanding of this new standard, ISO 15189 2022. So there are various training courses you might have undergone, but still after going through all these training courses or whatever training courses you must have undergone, the question still remains the same: how I should transform my laboratory with respect to this new standard, or how I should implement this new standard. Because you have understood the standard now, you have understood, you have got the all implications and interpretation of all the clauses, but still how I can implement this new standard in my medical laboratory, from where I should start or from where I should begin, and how I should start implementing, how I can implement this new standard so that my laboratory will get ready. You can have accreditation with respect to this new standard. Even if you don't want to go for your accreditations, the implementation of international standard is always good for a good laboratory practices. So let us see with this webinar, or through this webinar, how we can implement this new standard in your laboratory. So what are the main things we are going to cover in this standard, or basically in this webinar? Let us see. So basically we are going to focus on, we will have a short introduction of this standard ISO 15189-2022, then overview or the insight of this new standard ISO 15189-2022. Then we will see what are the different training needs, or what are the different trainings or awareness programs or awareness of documents you should be aware to implement this standard. Then for implementation, what gap analysis you have to perform with respect to the previous standard, and finally how to implement this standard in your laboratory. So to begin with this, we are going to see a short introduction. So as all of us have already undergone the training of ISO 15189, I am considering that you have undergone this training, and even if you have not undergone this training, you might undergo this training, as it is a mandatory requirement to undergo this training of ISO 15189. It is a mandatory requirement. So maybe in a recent future you will attend this course and attend this training program, so you will get the complete interpretation of this standard. So in this webinar, I am just going to cover a short introduction of this standard. So now here I have put a screenshot, which is basically a standard what we are going, or what we are talking about. It is an international standard ISO 15189, medical laboratories requirement for quality and competence, and it has been 4th edition, which was launched in December 2022. So this is the standard about which what we are talking, and how we are going to implement this new standard in our medical laboratory. So to see these objectives of this document, what are the objectives of this document, how this document, or what is the usefulness of this document? So first of all, this document or this standard will be useful to promote the welfare of the patient. So whatever basically we are going to implement the management systems, whatever processes we are going to implement in our laboratory, all are diverted or are directed towards the promotion of welfare of the patient. Next, we are going to plan and implement actions to address risk and opportunities for improvement. So basically this standard is more of patient safety related and has more focus on patient health care. And with this, we have to address what are the risks associated with the processes and policies of your laboratories, how to identify those risks and how to eliminate those risks. Then also next aspect is the opportunities for improvement. You have to find out what are the opportunities for improvement, and you have to identify those opportunities, and you have to use those opportunities to improve your services. Next is, this standard will be useful for the increasing the effectivity of the management system. So whatever management systems you have placed in your laboratories, with this use of this standard, you can increase the effectiveness of those management system, and you can decrease the probability of invalid results. Next part or objective of this document is, it will help to reduce the harms to the patient, laboratory personnel, and the public and the environment. So basically here we are not going to focus only on the test results. We are going to also focus on the reducing harm to the patient, laboratory personnel, general public, and your environment. So it has also covered the aspect of environmental management system. With this standard, you are going to compare your patient examination results between medical laboratories, regardless of the boundaries of the cities or countries. So wherever you are conducting the examination procedure, or whenever you are conducting the examination test, this will be having a comparable result all over the world or across the city or across the country. So basically, these are the main objectives of this document. So now one more aspect of this document is it can be applicable not only to medical laboratories, but it is applicable to diagnostic imaging, respiratory therapy, physiological sciences, blood banks, and transfusion services. So these are some of the additional features of this standard. This standard also facilitates cooperation between medical laboratories and other healthcare services. As we have seen, it is not limited only to medical laboratories. It is also applicable to respiratory therapies, blood banks, imaging modalities. So it will have basically a harmony between all the facilities with respect to the healthcare facilities. So basically, if you want to have a appropriate diagnosis of a tuberculosis, so you can have a diagnostic modality which is lab and imaging services. You can get it accredited so that you have a complete diagnostic setup for your tuberculosis, as well as the respiratory therapy which can be used in the management of tuberculosis patient. You can also get accredited for your respiratory therapy. So it will become a complete accredited setup where you will have a diagnostic cascade of laboratory and imaging, as well as the patient management cascade with respect to the respiratory therapy. So this is the additional benefit of this new standard. So now to see what are the different aspects of this standard, or what are the different focus areas of this standard. So this standard has given emphasis on risk management as per the ISO standard 22367. It has also given importance to the laboratory safety, as we have seen safety for not only for the patient but also to the laboratory staff and the visitors who are visiting your laboratory as per the ISO standard ISO 15190. It has also taken emphasis on sample collection and transportation system with respect to the ISO 20658. The format of this document is as per the ISO 17025-2017. So this, which is a specific standard for testing and calibration laboratory. So the format of this standard or the structure of this standard is as per the ISO 17025-2017. And finally, it has also included the requirement of point of care testing facility. Basically, if any of you are aware, there was a separate dedicated standard for ISO 22870, which was included for point of care testing facilities, or which were mentioning requirements for point of care testing facilities. Now with this new standard, this standard ISO 22870 has also been withdrawn, and you can implement the same management system to your point of care testing facility also as per the ISO 15189. So these are some of the major implications of this standard. Now we are going to see a brief overview of this standard, that what are the different sections. As all of you are aware, the previous standard ISO 15189-2012 had 5 main clauses, but here with this new standard we have 8 sections, where the Section 1, Section 2, and Section 3 remains the same with respect to the scope, normative references, and Section 3 is with respect to the terms and definitions. So all these 3 sections remain the same as per or similar to the previous standard. The Section 4, there is a change which is addressing here the general requirement, and which mainly addresses the impartiality of the laboratory personnel as well as the impartiality of the laboratory activities. So your laboratory personnel as well as the activities whichever you are performing in your laboratory, it must be performed in an impartial way. Then there is a clause on confidentiality, where you are going to maintain a complete confidentiality and privacy of the information with respect to the patient. Then clause 4.3 also talk about the patient rights, safety, and well-being. So these are the general requirement in this standard. Then we have clause 5, which mentions with respect to the structural and governance requirement, which include the legal accountability, that is legal identity and legal registration of your laboratory. Then we have laboratory director responsibilities. Then we have laboratory director job description, the responsibilities of the laboratory director, the competence of the laboratory director. Then we have management structure for ensuring the quality management. And in clause 5, we also have objectives, policies, and also a emphasis on risk management system in a laboratory. Then we have clause 6, we spoke about the resources which have human resources, including recruitment, training, and professional development. Then we have laboratory facilities, that is infrastructure of your laboratory. Then we have resources in terms of equipment, calibrations, meteorological traceability. Then we have resources with respect to the service agreement, with respect to the point of care testing and referral services. As point of care testing services are included in this new standard, we have a resource requirement with respect to the point of care testing, which is also included in this standard. Then we have clause 7, which is process requirement, where there are pre-examination processes, examination processes, post-examination processes, and we have process related to the handling non-conformance event, process related to complaint handling, process related to data maintenance, processes related to the emergency preparedness of your laboratory. So this was clause 7. And then we have clause 8, which includes the management system, responsibilities related to the management system, policies and objectives of management system, risk management in your management system, audits, corrective actions, continual improvement plan, and regular management system review meetings. So this was an overview of your ISO 15189-2022. So within a brief period or within a 5-6 slides, we have just understood what is the ISO 15189-2022 or what is the structure of this ISO 15189-2022. Now, coming to the next part. If you see the structure of this document, it is designed to prioritize your technical requirement and mentions the management systems at the end of this document. Unlike the previous standard, where the management system requirement was prioritized and it was mentioned in the 4th clause, and technical requirement were mentioned in the 5th clause. Here you can see the management system requirements are mentioned in the 8th clause, that is at the end of the document or in the last clause of the document. So basically this document emphasizes more on the technical requirement, and it has given a place of priority to the technical requirement of the laboratory. Now, coming to the what are the different areas where the most emphasis is given in this document. So risk-based thinking is a core concept of the management system. Here, the emphasis is given on the risk management or risk-based thinking. So if you have gone through this document, you might have come across that whatever activities the laboratory is performing or whatever the areas where laboratory is working, there has been given a more emphasis on risk management. Risk with respect to the patient, risk with respect to the laboratory staff, risk with respect to the environment, and risk with respect to the facilities. So this document or this standard has given more emphasis on risk-based thinking. And if you see wherever most of the places it is mentioned that you need to consider the safety of the patient, you need to consider the risk to the patient, you need to consider the risk to the facility or risk to the staff. So that is, it has given a more importance on the risk-based thinking. So whatever activities you are performing in your laboratory, it must consider the risk to the patient, because we are going to promote the services to the patient on the basis of risk-based thinking, and we are going to have a impact on the patient care. And as I have mentioned, this standard is more concerned with the patient safety. So the most important part of this standard is it is based on risk-based thinking. Then the ILAC resolution GA 26.08, the resolution was endorsed to allow a 3-year implementation period from the date of publication of ISO 15189-2022 standard. So basically, the ILAC resolution has given a period of 3 years. This standard was published in December 2022. So a period of 3 years, that means up to December 2025, all laboratories must comply with this new standard. So a 3-year period has been given to endorse this standard and to implement the management system in your laboratory. So we have given a period of 3 years to transit as a transition period to transfer to this new standard. Now, the important part comes here is the implementation. So we have seen the introduction of the standard. We have seen what are the important aspects of this standard. Now, the main part of this webinar or the main focus of this webinar here is the implementation, what we are going to implement, how we are going to implement this standard, from where I have to start and from which point I should start implementing this standard. So the most important part of the implementation is get yourself aware about the standard. So awareness is very important. You have to undergo the training. You need to train the trainers of your laboratory. Who are the trainers of your laboratory? Basically the supervisors, the managers, the lab directors maybe. These are the trainers, because these people are going to train the other staff or other personnel of your laboratory. So first of all the trainers must get trained in this new standard. They must be aware of this new standard. They must be also aware about the what are the different documents which are applicable to this new standard. So first of all, you must have awareness about this standard. Now, how you can get this awareness? Maybe you can attend such type of webinar, or you can read some type of literature. Then you have to get trained. So for training, you can attend the 4 days training for ISO 15189-2022, who are freshers, those who have already done the previous course, that is ISO 15189-2012, they can go for a refresher course for 2 days and they can get themselves trained. So first important step is train the trainer. So this training part must be conducted for the trainers first. Who are the trainers? Those personnel who are going to train their own faculties, or those personnel who are going to train their own laboratory staff or laboratory personnel. They must undergo the training. And then you have to train your laboratory personnel. You have to make them oriented. You have to make them aware. You have to train them with respect to this new standard. Now, how to do it step by step manner? Let us see. So first of all, you need to undergo some trainings. So what are these different trainings you should undergo? So here I have mentioned some list of the trainings. You need not have to undergo the trainings for all of these ISO standards, but you can at least read the standard. You can make aware of yourself, and you can see what are the implications of this all ISO standard in your laboratory and wherever they are applicable, or you can use them for implementation of your management system in your laboratory. So first of all is the ISO 15189-2022. As I have mentioned, this is the standard, or this is the document basically about which we are speaking. So you have to undergo a training for ISO 15189-2022. Then you must be aware or trained in this ISO 9001-2015 document, which is with respect to the quality management system. You must be aware or trained with respect to the ISO 15190-2020 document, which is with respect to the requirement of safety in medical laboratories. You can also read this standard, that is ISO 17025-2017 document, which is with respect to the general requirement for testing and calibration laboratories. Then there is a specific standard for risk management in medical laboratories, that is ISO 22367-2020. Now, as we have mentioned, this standard is completely based on risk-based thinking. So it is very important that you must be aware about the risk management in medical laboratories, and you must have appropriate orientation and knowledge with respect to the risk application or risk management application in your laboratory. So I will advise to, or I will suggest all of you to read this document. If required, you can attend some training program on this document so that you can have appropriate implementation of risk-based approach in your laboratory. The next trainings which I have mentioned here are ISO 22583-2019, which is the guidelines for POCT operators. As I have already mentioned, with the implementation of this new standard, the requirement for point of care testing facilities has also been included in this new standard. So if you want to include point of care testing areas, point of care testing facilities under your management system, you must be aware of this standard with respect to the point of care testing operator. Then there is a standard ISO 22658, which is with respect to the sample collection and transportation, which is applicable for your collection centers, collection areas, phlebotomy areas. Then there is a standard for 001 2019, which is with respect to the biorisk management. Then there is a standard for ISO 19011, which is respect to the guidelines for auditing management system. So this document is going to give you idea about the auditing of your management system. That means the internal auditing of your management system. So to have a appropriate knowledge, you must be aware about the different principles of management auditing. You must be aware of different methodologies of auditing. So you should also have a knowledge or awareness about this document, which is with respect to the auditing management system. And then there is a standard 20914, which is with respect to the measurement uncertainty. So you can also go through the standard for the having clear idea about the measurement uncertainty. Why measurement uncertainty is important here? As we have seen, the standard has given priority to the technical requirement. In addition to the risk management methodology, it has given priorities to the technical requirement over management system requirement. So to have a complete knowledge of your technical requirement, your uncertainties in your measurement system, you should have a knowledge and awareness about this new standard, which is a this is not a new standard. Measurement uncertainty is not a new standard, but it has this is the second publication 2019. So you can undergo or you can have a knowledge about this standard about the measurement uncertainty. Then there are certain other documents which include requirement for information security. So this is standard ISO 27001, which is with respect to the cyber security. Then and risk management of cyber security is also included here. Then there is a requirement for sample collection and transportation. This also I have already mentioned. And one additional document is there, that is CLSI GP36 guidelines, which is with respect to the planning of laboratory operation during disaster. So basically this document covers the emergency preparedness planning of your laboratory. Now why it has given a separate place or separate importance in this document? So all of us have already undergone a pandemic of COVID-19. So we have seen that most of the laboratories were not prepared for handling the pandemic situation. The emergency preparedness planning was not sufficient, and there was a complete collapse of the diagnostic system in the initial period. When the COVID-19 pandemic started, during the initial period, we were not able to handle the situation as our manpower were not trained, we were not ready to handle these pandemic situations with respect to the, we didn't have technically trained staff, we didn't have appropriate infrastructures, equipments were not available. So this new document or this document has given a special emphasis on planning your laboratory operation during disasters or during emergency preparedness of your laboratory. So these are the certain trainings of you should undergo or you must be aware about all of this document. Now moving ahead, what you have to do. So once you have undergone a training, now first of all we are speaking about the training of the trainer. So we are speaking about the training of the trainer, training of the supervisors, training of the managers, training of the laboratory director, or training of the other supervisory staff of your laboratory. So once you have undergone the training of ISO 15189 and other relevant documents, and you are aware about the other relevant documents at least, then you have to move ahead. What you have to do? You have to now classify your ISO 15189-2022 as per what are the documentations required, what are the procedures required, what are the processes are required, and what are the records are required. So basically you have to enlist. While before implementing a standard, you have to enlist all the requirements. What are all documentation required? What are all mandatory documentations are required? What procedures are required? What documented procedures are required to be created? What processes are required to be created? And what will be their corresponding records? So you must have a complete list of all these documentation processes. So you should have an appropriate documentation. You must make a list of all these documentation, procedures, process, and records that you will be required in your implementation of this new standard. When it will be possible? It will be only possible if you have a complete awareness and complete training of this new standard. So the first part is the training part, and next part is making a list of all these procedures and documentation work. So once you are ready, the next step is you have to do a gap analysis. What is meant by gap analysis? Gap analysis is basically you have to see what is your current state and what your meant. So what will be your future state? So current state, here we have ISO 15189 2012. The future state is going to be ISO 15189 2022. So you have to have a gap analysis. Now what is meant by gap analysis? You have to find out what are the key steps to bridge the gap. What are the gaps are there? What were the procedures, policies, and processes were required in the previous standard? Now, what are any new procedures are required? Any new processes are required? What new records are required? What new activities needs to be performed in your laboratory? So you have to have a complete gap analysis of your situation with respect to the previous situation and with respect to the future state what you are going to implement. Now, how you are going to do it? You need to have a conduct a gap analysis. Now, how it can be conducted? So you have to assess the current systems. You must be aware about the current policies of the laboratory, current processes, current procedures, current management systems of your laboratory as per the previous requirement, and you have to see it how you can align it with the new requirement. What are the new requirements we have seen already, because we have made a list of documentation, we have made a list of procedures, we have made a list of processes and records. So during a gap analysis, you will come across what are the extra documentations are required, what are the extra processes needs to be implemented, what are the different new activities you have to undergo, and how it can be implemented. So by doing a gap analysis, you can see what are the current gaps in your management system. Now, who will perform this gap analysis? It is to be done by internal auditor. As I have mentioned, there is a document called ISO 19011, which is with respect to the auditing of the internal management system. So those persons who have knowledge about the auditing of management system, or those persons who are trained in the internal auditing system, these persons must perform the internal audit with respect to the gap analysis. And now where it should be performed, this gap analysis, we have to perform at all the levels. You have to perform at facility levels, at your infrastructural levels, instrumentation level, documentation level, resource level, manpower level, or and at the organizational level. So a gap audit as an internal auditor must be performed at all the levels of your organization. Now, once the gap analysis is performed, you have to focus. While performing the gap analysis, you have to focus on some of the important areas. Now, what are these important areas? One is the risk assessment and patient care. Why we want to focus on these two areas? Because we have seen that this standard has a more focus and more emphasis on risk assessment and is a more concern with respect to the patient safety and patient care. So we have to give a more emphasis while performing a gap analysis. We have to address these two areas mainly with respect to the risk assessment and patient care. The other areas where we should focus are EQA, customer feedback, process control, and equipment. So whether there are any resource requirement are there, where there are any process requirement are there, where there are any management system requirement are there, or where there are any other process requirement with respect to the quality assurance are required. So you have to focus on these areas. So you have to perform a gap analysis by performing an internal auditing of your laboratories and mainly focusing on these areas. Now, once you have identified the gaps, you will come across, while performing the gap analysis, you will come across some areas where or which are not in line with the new standard, because you are implementing the previous standard ISO 15189-2012. So there will be some areas where which is not as per the new standard. So you will have to identify such gap. You have to identify such gap. Maybe you are not giving more emphasis on risk management in the previous standard, though it was already there in the previous standard also. it was not given that much importance for risk management. So you have to identify such areas which were missed or which are not in line with the new standard. You have to identify such gaps in your management system, and then you have to have an action plan. You have to develop an action plan to align your processes with respect to the new standard. So wherever there are gaps, you have to modify your processes. Maybe you have to redesign your processes, or you have to put some new processes into place which will be in line with the new standard. Now, who is going to perform these things? As I have mentioned, the trainers, the quality managers, laboratory directors, or laboratory managers, supervisors, because they are already trained. The first aspect was train the trainer. So those who are trained, they should perform, or they should take over the responsibilities to implement the action plan. So as per the action plan, as per the requirement, whatever new processes, whatever new procedures are created, wherever the procedures were redesigned, new processes are implemented, wherever the processes were modified, you have to revise your quality documents. You must revise the quality document as per the new requirement, because as you can see, there is a complete change in the structure of the standard. So you have to revise the quality documents so that it can be aligned with the new requirement. So this can be done only after finding having appropriate action plan to align with the new standard. Then you have to revise your quality documents. What comes after revising the quality document? You have to train the. Now, once the trainers have performed their duties, once the trainers or once the supervisors have performed their duties with respect to the revising the documents, with respect to the gap analysis, and after revising the documents, now it is responsibility to train the other technical staff or other laboratory personnel in your laboratory. Whatever new documents are created, whatever the new processes are created, whatever processes are modified, whatever processes are redesigned. So you have to train your subordinates, you have to train your other technical personnel or other staff of your laboratory with respect to the new revised quality documents or with respect to the new revised management system documents. Then all these documents must be authorized and adopted with clear effective date. So you have to put a date from what date you are going to adopt this new document. See, this can be performed only after your all the personnel are trained. So once your personnel are trained, then you can adopt the new document and you can mark the effectiveness of this document. Then you have to monitor the implementation as a part of continuous quality improvements. So once you have made changes to the management system, you have to monitor the management system processes. So once you have made the changes to the management system, you have to monitor what is the progress of implementation. Wherever the processes are changed, wherever the processes are newly designed, you have to monitor the performance of all those processes as a part of continuous quality improvement. And once you have finished the monitoring or once you have placed the complete management system in place, then you can have a liaison with the accreditation bodies for the reassessment. See, this liaison with the reaccreditation or accreditation bodies is a voluntary process. So after implementation of this new standard, then you can have a appropriate communication with the accreditation bodies and you can have a reassessment of your laboratory as per the new standard. So in gap analysis, we are going to emphasize on risk management and patient care. We have to designate a focal person that will lead to the processes, who can establish a system to manage risk and opportunities for improvement. And the personnel also must be ensured that the training and other QMS implementation tools are aligned to the new ISO standards. So once you have performed the gap analysis, you have implemented the process, you should have an appropriate training of a new personnel. So as I have mentioned, once the supervisory work has been done, you need to have an appropriate action plan and you should have an appropriate focal person who can lead the process of change, because you have to have a transformation from old processes to the new processes in certain areas. It is not necessary to change the processes in all the areas, since there are certain changes with respect to the new standard. We have to modify certain areas. We have to redesign processes in those areas. So you should have an appropriate focal person who can lead this process change. And after changing the process, you should have appropriate training on the new QMS implementation. Because now we have implemented a new management system. The new management system is as per the new standard, which is ISO 15189 2022. So we have to train. The designated person must ensure that all the personnel in your laboratory are trained with respect to the new standard and the new management system. Now, while implementation of this new standard, as many of you must have undergone the training for this new standard, you might have these two major dilemmas. I am specifically addressing these two dilemmas here for all of you because there are two major issues in this new document, that quality manager and quality manual. Now, if you see that with respect to the old document or ISO 15189 2012, both these requirements were mandatory. Requirement of a designated quality manager and requirement of a quality manual. Both were a mandatory requirement with respect to the previous version of this standard. But with respect to this new standard, both of these terminologies has been removed from the document. Then many of the people comes to me having a dilemma whether quality manager is required or not, then who will perform the function of quality manager, whether quality manual is required or not, then where we are going to mention the policies, where we are going to mention the procedures if quality manual is not there. So here we are going to make these two doubts clear, that quality manager, even if the term quality manager or even the position is not mandatory with respect to this new standard, in a standard it is mentioned that there must be a person or personnel who have the authority and resources for the management of the quality management system in your laboratory. So there must be a person or personnel, or it can be one person or more than one personnel who have the authority and resources for the implementation of the quality management system. So a dedicated or a designated person is required for the implementation of the quality management system. You may call him as a quality manager, or you may not call that person as a quality manager. You can simply call that person as a supervisor or as a lab manager or even as a quality manager. The only thing that it is not mandatory to have a designation of quality manager. It is not mandatory, but there must be somebody who has authority and resources to implement the quality management system. And the next aspect is quality manual. Again, if you see that in the previous standard, it was mandatory to have a document named quality manual, and you have to include different procedures or policies in that quality manual. But now with this new standard, the mandatory requirement of this document, which is named as quality manual, is not there. So how you are going to write down your policies and procedure? Basically, the management system documents can but are not required to be contained in a quality manual. So this is a specific clause in your standard which mentions that you can have a quality manual, but it is not mandatory. It is not required to have your documentation in the document which is named as quality manual. You can call that document as a lab manual, as an Apex manual, or even as a quality manual, or as a policy manual, or as a documentation manual, or management system document. So whatever you call, you can call it as a by different name. It is not mandatory to name it as a quality manual. So these are the two basically major dilemmas where people are coming to me with this major thing, whether quality manager and quality manuals are required or not. So personals are required, you can call them anything, lab manager, supervisor, or even quality manager. Manual is also required, you can call it as a lab manual, quality manual. The designated names are not mandatory. You can call them anything as per your convenience. So these are the two major dilemmas where I have discussed here. Now, one more aspect, I have specifically mentioned that continuity and emergency preparedness planning has included in this new standard, and why it is included, that also I have mentioned, because since we have seen that during the COVID emergency or during the pandemic, most of us, the laboratories and most of us were not prepared to handle the situations. So in this new document, it has given more emphasis on emergency preparedness planning. So for that purpose, your laboratory must have a plan. You must have appropriate training. You must have appropriate heat or water preparedness is required. Information is required to handle the all emergency situations, and your laboratory personnel or staff or the authorities must be informed with respect to the emergency preparedness planning and handling of the emergency situation. So that is why this document has also given emphasis on emergency preparedness planning and continuity of your laboratory services during a disastrous situations or in the emergency situation. Now, as point of care testing is also included in this new standard. So there is an option for all the healthcare facilities to include this point of care testing facility under the management system of your central laboratory or as per the ISO 15189 2022. So before concluding this session, I have included this one slide on point of care testing facility or implementing the new standard in this point of care testing facilities. So what readiness or what preparedness are required? What are the necessary requirements are there to implement the management system in point of care testing facilities? So first of all, you have to enlist what are the activities, what are the different tests, what are the different areas you are going to cover in point of care testing facilities, or what are different areas where you are going to implement this management system for point of care testing facility under your central laboratory. What are the facilities required, infrastructure required, space requirement? Many of the equipment may require a specialized space for the test carrying the testing activities. Waste discard facilities may be required. Dedicated storage facilities may be required for implementation of management system at point of care testing facilities. So you have to have a appropriate facilities for carrying out point of care testing activities. You must have operators and authorities and competency training of these operators. So you have to train the operators because the point of care testing activities are not carried out by the laboratory professionals. Point of care testing activities are carried out by nursing staff, by paramedical staff, maybe by some clinical assistant or even by clinicians. So these are not the laboratory trained personnel. So you should have appropriate competency and training of the POCT operator. What are their authorities? What are their authorities with respect to the review of the research? What are their authorities with respect to the different activities? Their authorities with respect to the handling of the specimens, discarding of the specimens, that you have to make sure and you have to train all these operators. Then you should have a service agreement. Your laboratory must have a service agreement with this POCT operator. Why? Because it is not the actual part of your laboratory, and even it is not handled by the trained laboratory technical staff. These are handled by paramedical staff, nursing staff, or clinical assistant. So you should have an appropriate service agreement with the point of care testing facility users. For that purpose, you can have a multidisciplinary care testing committee where there can be a representative from laboratory, there can be representative from medical faculty, there can be representative from nursing faculty, paramedical faculty, and quality faculty or quality areas, and other areas of those personnel who are related with the point of care testing activities. So you should have a multidisciplinary committee. Again, it is not mandatory to have a committee or multidisciplinary committee. It can be modified as per the requirement of the laboratory. Then you should have an appropriate quality assurance program for point of care testing activities. You should have appropriate IQC testing, proficiency testing, EQA whenever it is available, or other type of quality assurance program needs to be followed at point of care testing facilities also. So if you want to implement management system for your point of care testing facilities, you must consider these areas: POCT activities, facilities, operator training, service agreement, multidisciplinary committee, and quality assurance. So again, it is not mandatory again to include all the point of care testing areas of your healthcare or healthcare organizations under the laboratory. If it is possible, if it is feasible, you can include these areas under the management control of the laboratory, or it cannot be included as per the if it is not feasible. So before concluding, I have just two takeaway messages here, that laboratory activities shall be carried out in such a way as to meet the requirement of this document, the users, regulatory authorities, and organizations providing recognition. So this line I have taken directly from the standard, that whenever you are following any laboratory activities, you have to meet certain requirements. And what are these requirements for implementing the standard? You have to meet the requirement of this document. What are the requirements are mentioned in this document? You have to comply with the requirement of this document. You have to comply with the requirement of the users. You have to comply with the requirement of regulatory authorities. Regulatory authorities are healthcare authorities, are local regulatory authorities, governmental organizations. So you have to comply with the requirement of those regulatory authorities, and you have to also comply with the organizations providing recognition. So those organizations which are providing accreditations, those organizations which are providing certifications, you have to comply with those requirements also. So the laboratory must comply with the requirement of this document, requirement of the user, requirement of the regulatory authorities, and requirement of the organizations providing recognition or certification. The next takeaway message is, laboratory management shall ensure that the integrity of the management system is maintained when changes to the management systems are planned and implemented. So why I have included this slide, and basically this is also taken from the document itself, that is clause 5.5.c. Why I have specifically included this clause? Because we are going to transfer the management system from ISO 15189-2012 to ISO 15189-2022. So there will be changes in the management system. So to maintain the integrity of the management system, to maintain the appropriate functioning and appropriate operations of your management system, whatever changes you are going to make, whatever actions plans you are going to make in your management system as per the gap analysis, as per the requirement, all those plans, all those changes you have to plan, and then only you have to implement. There should not be any sudden changes or sudden implementation of new guidelines. You have to plan the changes, you have to implement those changes, you have to monitor those changes, and then only you can see that you have implemented the new management system in your laboratory. So to ensure the integrity of the management system, you have to plan your changes, and then only you have to implement those changes. So with this slide, I am going to conclude this session on implementation of new standard with ISO 15189-2022 in your laboratory. So if you have any queries, any doubts, we can take if we have time. So yes, we have time, 5 minutes at least we can take.
Yes, so there are few...
I would like to extend my sincere gratitude to Dr. Jayesh Warade for generously sharing his expertise to all our participants who have indeed taken their exclusive time to be a part of this webinar. So your presence and active involvement really truly made this webinar very, very special. As we progress through this event, I would like to invite our product manager biochemistry, Mr. Anil Makhija, who will it's just a 5 minutes session on a very new innovative instrument from Mindray for biochemistry, which follows the Six Sigma and many of its parameters are Six Sigma. So may I invite Mr. Anil Makhija.
Good afternoon, everyone. I'm Anil Makhija. I'm the product manager for biochemistry for Mindray Medical India. So I'm just going to take you through few slides about the latest instruments from Mindray. Yep. So as we all know, we have a very basic instruments starting with BS 230 and 240. That is up to 200 tests per hour throughput machines. Then we have all the way up to from 200 throughput to 2000 tests per hour. So we have 240 test throughput machines, 400 throughput machine, that is 430. And we have a latest entrant in this Mindray portfolio, that is 600M. And then we have high-end throughputs, that is 800 throughput machine. And then we have integrated system, that is SAL 6000. So just in few slides. Yeah. So it has a throughput of 600 tests per hour, and with ISE it is 800 tests per hour. It is a drag model where you can load around 120 samples. The minimum reaction volume is 70 microliters. And sample volume start with 1.5 microliters. And we have a whole blood HbA1c testing. That means there is no need to centrifuge the samples. And it is a very small footprint instrument. So all the QC and calibrator data is provided through a barcode. So there is no manual entry of the QC and the calibrator data. So there are smart indicators in the instrument. One is for instrument status, whether it is standby, consumable shortage, or it is off. Second is for the test status, where it tells you about how many tests has been consumed, how many tests are remaining, and what is the timeline to complete those tests. And last is for samples. It tells you about the samples, how many samples are ordered, aspirated, running, and complete. So these are the three smart indicators are there in a new analyzer. Then it has a lot of safety data features, like it gives you the enzyme linearity extension, where the enzymes up to 2500 or 3000 is detected during a single run, and it's go for auto dilution, auto rerun. Same way, it monitors the reaction curve for triglycerides. And in case of very high samples, it gives you an alarm saying that it's a very high value sample, need dilution and rerun. Same in the case of antigen or antibody access for microalbumin urea. So it's called as a hook effect. It's given an alarm and goes for auto dilution and auto rerun. For HbA1c, it basically predicts the HB and accordingly modifies the sample to reagent ratio. And it is avoids any variant interferences because we are taking only first two amino acid of N-terminal of glucose. This is a very important features. This is the new features which we have included in BS600M, that is 6 Sigma performance. Already we had a session last year on 6 Sigma. It's basically, working towards improvement in the quality, a better CV, and better, you have a good bias, less bias. So all the parameters, the routine parameters with level 1 and level 2 from Mindray was between 5 to 6 Sigma. That means you are achieving a very good quality in terms of the reagent performance. So lastly, we have very smaller throughput, that is 1.2 meters square, 600 tests. Compared to competitions, you get high throughput, 504 tests per hour per meter square, compared to competition, which is between 300 to 364 tests per hour per meter square. So lab space is a very constraint in a metro cities. So this is a very good analyzer with high throughput and low footprint. It's again very cost efficient. It's basically HbA1c, we are reducing the cost by 30% because the reaction volume is reduced to 70 microliters. And for ISC, there is a reduction in the cost by 40% because ISC consumables electrodes shelf life is increased from 6 months to 9 months. And for chloride, it is 6 months. And SIP cycle of 1 hour. It's a very maintenance-free analyzers because here you were using a reusable plastic cuvettes. So there is less hidden cost, and we have a very good patented syringe design, which take care of the 5-year service time. So thank you very much for the BS600, attending this the short presentation on BS600.
So thank you, Mr. Anil. May I request you to stop share screen? So over to Dr. Jayesh Warade again.
I think I have given answers to all questions.
Yeah, I saw you have typed the answers. So Nikhil.
Yeah, if anybody wants to speak and ask any question, they can.
So it is open for all the attendees.
We can give them the speaking rights. Like
So please raise your hands and you can speak and ask any questions. I see Miss Pooja Kadam hand raised. So Miss Pooja Kadam, can you please unmute yourself and ask your question?
Yeah, I have given you the rights, madam, to all of you who have raised your hands.
Miss Pooja Kadam, please unmute and ask.
She's trying to speak, but we cannot hear it.
Yeah, I think so.
No problem. If anybody else has any questions or would like to speak to the faculty, please raise their hand.
We see Miss Supriya Chavan.
Quite a few.
Miss Supriya Chavan, can you please unmute yourself?
Yeah, most of you have been given the rights to unmute and unmute. So please, you can just.
Please unmute yourself and ask Miss Supriya Chavan. Okay.
Yeah, yes, Steven, sir, you have some questions.
Yes, sir, I could just asking, is it possible to get the recording of the whole session that has been shared?
Yeah, after faculty sir's approval, we will make it available on mindray.com.
If Dr. Jayesh Warade approves for the...
Yeah, basically I don't have any issue. You can share it to all the participants.
Yes,
no, you can put it on your website or maybe add some other resource.
Yes, sir.
Thank you, sir.
On YouTube and also on our website, sir. Thank you.
Okay, thank you.
Hello, am I audible?
Yes. Mr. Himanshu, you are audible.
Yes, good afternoon. So I just want to ask Dr. Jayesh views on that. If I am not wrong, there is no mandate on the quality manual in this new standard, as it follows the ISO 17025. So there is no mandate that how should we proceed in quality manual. It is entirely up to the lab if they want to have a quality manual or not. So what is Dr. Jayesh views on this?
Whether you are speaking about again the quality manual?
Yes, sir. His question was on the quality manual.
Yes, sir. Yes.
As I have also discussed in the presentation also that the requirement of as such a document named quality manual is not mandatory, but still you need to have documentation of your policies, you need to documentation of your objectives, you need to documentation of your procedures. So at some place you have to write it down. So you can make.
So sir, as this is entirely up to the lab that but they have to name their documents, but they have to have all the documents regarding this ISO 15189.
Yes.
But what are your views if a lab should have one quality manual or not? How should they proceed with this new process?
So that is what you can maintain your quality manual. There is no offense in maintaining your old quality manual with including the new changes. But it is not mandatory to name that document as a quality manual. You can just name it as a lab manual. You can name it as a management system document or anything else. It is not mandatory because in previous standard, it was mandatory to have a document called quality manual. Now it is not mandatory to have that document. But still you need to mention all those procedures and policies. So you can maintain it in your quality manual or any other document and you can call it as anything else. Whatever you want, you can call it. It is up to the laboratory, what they want to call.
So there are some other questions too in the Q&A section, sir. There is a very interesting question from one Mr. Anonymous attendee. For labs undergoing NABL inspection this year, will the labs be assessed based on the clauses and requirements of ISO 15189-2022?
It depends upon your own application, how you have filled the application. If you want to go with the new standard, it will be with the new standard. If you want to go with the old standard, it will be with the old standard. There is no mandatory that you have to go with the new standard. As per the laboratory's wish, the laboratory can apply with the new standard or with the old standard, and they can get themselves assessed with respect to the new or old standard.
Okay. There is another question. What is the minimum requirement of the person who can look after QMS?
As if you have undergone the training of ISO 15189-2022, nowhere it mentions about the minimum qualification with respect to the person who will be taking care of the quality management system. But as an expectation, he or she must be trained in ISO 15189-2022. But the standard doesn't recommend anything. The standard only recommend that the person must have an appropriate competence and appropriate training or appropriate authorities to perform those activities. As you can see in the standard, nowhere in the standard it mentions with respect to the qualification. It simply mentions with respect to the competency and with respect to the authority.
There are a few questions, sir, if I can go through them and are you okay with it?
Yeah, you can go.
Okay. Because it will be beneficial for the group, so that's why. Okay, so there's another question, like old standard 2012, need to buy new standard 2022. Is it available on ISO website for purchase? As some assessors want hard copy to be in your lab.
You can buy it. See, it is very subjective whether your assessors wants to have it in hard copy. It totally depends upon the accreditation requirement. As a part of the standard mentions that you should have a referral document or reference document should be available in your laboratory. Now, how it should be available, that is up to you. You can make it in the computerized soft copies or you can make it into a printed copy. It is up to you. It doesn't, the accreditation requirement or standard doesn't mention or make it mandatory to have the printed copy.
Otherwise, you can just purchase this from your national bodies. As in case of India, BIS is our national body, so we can purchase it from there.
Please let us know from which date does ISO 15189-2022 is implemented, as we are preparing for NABL. There is a question from Ms. Shweta Gupta.
ISO 15189-2022 has started been implemented already, as I have mentioned, since December 2022. As far as your accreditation is mentioned, you can check with your accreditation bodies or you can check with the other certification bodies what are their requirements. ISO has already started implementing this standard. What are the requirements of your accreditation bodies or what are the requirements of your certification bodies? You can directly check with the accreditation bodies or certification bodies on their respective websites.
Is NABL or IQAS will abide to the same standard henceforth for next surveillance audits or till December 2025? We can use.
As I have mentioned, it totally depends upon the lab, what lab has to implement. But you have been given a period of 3 years. In these 3 years, you have to get converted yourself to the new standard or you have to get transform yourself into the new standard. The accreditations or assessments or surveillance which are happening in near future or recent future, it totally depends upon lab, what lab wants to do. Lab can go with the new standard or lab can go with the old standard. There is nothing mandatory. You need to get yourself transformed to the new standard before December 2025.
Okay, so I think the later questions are all like you have answered. Okay, one Mr. Ashutosh Kumar Singh is asking, sir, we are preparing for NABL accreditation. What should be the procedure will be taken for safety SOP?
Safety SOPs or safety procedures, if you see there are any changes with respect to the new document, you can implement those changes in your laboratories. If there are no changes, like safety procedures, what safety procedures we have? We have safety procedures with respect to the needle stick injuries. We have safety procedure with respect to the spillage of the samples or spillage of biological materials. We have safety procedure with respect to the fire safety or electrical safety. So I don't think there are any changes into these SOPs. So you need not have to make any changes. Whatever you are following, you can follow the same.
Okay, so most of the questions are now answered, sir. So I would personally like to thank you very much for this time that you have given to enlighten all our fraternity. And we would look forward to hearing from you also in the future. So thank you very much, Dr. Jayesh Warade.
Thank you.
And thank you all the participants too. Thank you.
Shama, one small announcement. The certificates will be sent to everyone via email next week. So all the participants who have attended the webinar will get their certificates via email.
Okay, thank you. So you will receive your certificates by email. Thank you.
And as sir has approved, the recording is available on Mindray India YouTube channel and Mindray website, the same place where you registered for the event. So if you have any queries, please go to www.mindray.com and you can select India, and then you can get our contact numbers and everything. Thank you very much.